Hi, we're here today to show you how to put on the Sealong oxygen hood. First, we're going to measure the patient's neck. This is our patient. Pick your hair up, please. We'll bring it around. See where this touches on the equipment that we give you. Sorry. Now I know that your neck is a 13 1/4. You might say that for later. So when you get your instruction sheet, it will show you the definition of each one of these rings. Now they're probably going to be hard to see on video, but each one of these is measured on that instruction sheet. So let's say for a 13 1/4, I know for a fact that there's a line between 13 and 14 3/4. So that's going to be the fifth line. 1, 2, 3, 4, 5. And because it's in the middle of the range, I'm going to cut between these two lines, as is the range between the 13 and 14 3/4, approximately. So we're going to pause, we'll cut this, and then we'll install the hood. Now we're going to cut the neck seal to the dimensions that we measured with the included measuring tape. One thing to remember, very critical on these neck seals, you never want to cut directly straight down like this. What that's going to do is give a path for a crack and a tear to start, so don't do that. First thing that I want to do is, once we have that measurement, I'll identify the proper ring to cut to. In this case, it was between 5 and 6. So we have 1, 2, 3, 4, 5, 6. So I know that I want to cut someplace right in here. And what I'll do is I'll go around and make me some marks on exactly where that needs to be, so I can keep up with where I am during the cut. This gives a very good map so I don't get off course, because sometimes if you move from one spot to the other, it's easy to lose your track on which particular line you're cutting to. Now I'm going to go ahead and cut this because it takes a little bit, and we'll rejoin in just a little bit. All right, now we're ready to put the neck seal on. So I have a wonderful assistant here, and we always recommend, if at all possible, have 2 people to put this on. It ensures that you won't tear the neck seal, and it's really much more comfortable for the patient. So what we'll do is each one of us will grab it, and you're actually rolling it. It's hard to tell, but we're rolling this into like a Tootsie Roller. Then you pull it out, and that roll helps make sure that you're not going to tear the neck seal. And plus you have a nice wide smooth opening to go over the head. You want to lean it a little more over the front part of the head first, and give room for the chin and the mouth. Now, if you will please bring your hair up. Now we'll slowly let this loose, maintaining the roll, because you want the roll to sit on the patient's neck. You can see how this is actually rolled. It's much more comfortable for the patient, and it does also ensure a better seal. All right, now we're ready to put the head tent on the patient. So with our wonderful assistant, in this case she has hair we have to contend with. We'll put it over the front. We'll start right here, always with the front, then we'll move around and push it in. It's the end, that easy. And to remove it, you start at the back, pull it apart, and then come off in the exact reverse. All right, now we're ready to remove the neck seal. Gather up the neck seal material, up over the nose, back over the back, all done. Now I'm going to show you a second way to assemble the hood and neck seal and put it on the patient. There are lots of centers who really like to assemble them in advance and then put them on. And there's a very critical feature as part of this, That also applies to the method of putting them on separately is the proper orientation. You'll see a non-smooth surface with kind of a rough texture. You'll see the accessory port sticking out. This is the top, and it's always the top. You never install it like this. It creates a lot of problems. It won't operate correctly. It can actually be detrimental to the patient. Don't do this. Do it like this. This is the face plate with a visor face. You start there and work your way around, front to back. And now it's all the way in, you have a good, ready to install product. Now you gather up the neck seal, just like you did in the other method, opening up the hole as big as you can. Slowly release the neck seal. Now it's installed. Now we're ready to unpack the included accessory kit. We have a very important part for bacterial biofilter. One-way directional valves. This is the adapter to use the PEEP valve. Now remember, some of these in your kit may look slightly different. They'll still work the same, but they may be slightly different. The PEEP valve, another directional adapter, the multi-line adapter, the included second accessory port. This is used on the neck seal to provide a port for feeding tubes, liquid. You can administer medications, a lot of different sources, so you can have a different one. The hood clips and the hood straps. Now we're ready to assemble all the accessories onto the neck seal. First we start for the inflow port. And something you really want to be sure of is you have the right one in the right direction, because it has to only flow one direction, in and out. Next we're going to put the adapter on here, the one-way valve that goes one direction. Bacterial viral filter, that ensures that any of the gases coming out of the hood from the patient are sterile and not escaping into the atmosphere. You assemble the PEEP valve to its adapter. That has to be done first or it won't fit correctly. When you put it on, it swells up to give you a good positive seal. Now we offer an accessory that we created. It goes on the inflow line called the multi-port adapter. It simply goes on in place of the inflow line, and this allows you to operate the hood with only wall air and oxygen. So you'll hook up the 3 7mm lines per your respiratory therapist or doctor's instructions. This will provide all the pressure and flow you need to operate the hood. Now we're going to show you how to assemble the hood straps and the included clips. It's best to start with giving yourself some range to adjust it for the patient's comfort. You put this on just like a button on a shirt. You roll it in like that. It's in, just that easy. Somewhere in the middle. It's not really critical, but you want to make sure that both of them are in the same hole. Not a problem. Just do it again. You want the clips pointing outward in opposite directions. Now we're ready to install the clips pre-assembled on the straps to the hood. We're only going to be installing it on the front part first. That's personal preference. You could install it on the rear, but it only needs to be one or the other, not both. So grab the clip. Ensure the tab is facing up. You'll get in the bottom. It only goes one way. When it's in the bottom, minor amount of pressure is all it takes. To take it off, it comes off that easy. Don't put it the other way. If it doesn't go that easy, something's wrong. Now it's on. Now, the next step, we'll gather it up, just like we've always done before. Putting it over the patient. Lift your arms up, please, patient. This goes underneath, and quickly and easily clicks on the back. Now it's on. To take it off, you can have it off in 2 seconds, just that fast. Break the seal, pull it off.